The first in the country ban on the sale of all vape products will continue for at least another 2 months after a state judge denied industry appeals to strike down the governor's ban. But the ruling wasn't a total win for the Baker administration, which was forced to formally submit the ban as an emergency regulation in order to continue restricting nicotine vaping products. The governor has argued the product should remain off store shelves in Massachusetts while health officials figure out the cause of vape-related lung illnesses that have sickened more than 1,600 people and killed 34 nationwide. The deaths and the ban come amid what health officials are calling a teen vaping epidemic. So is any of this stopping teens from vaping? Stephanie Leydon visited a local high school to find out.
Startling new developments in the vaping emergency.
More than 500 cases of lung illness.
News that vaping can cause serious lung illness.
The first vaping-related death in Massachusetts.
And even death may give you pause. But at Danvers High School, seniors Chloe Callahan and Taylor Brett say the warnings about the dangers of vaping have had limited impact.
We've had so many talks on it that it gets bothersome. The school is using lots of fear tactics to kind of scare kids away from it. And I feel like it's just so overused at this point that it's not really helping.
And to be clear, they both say there's a problem. So many kids here vape, Callahan did a school project to find out why.
Fitting in, just want to be cool, my friends are doing it.
Over the last couple of years, they've watched as vaping spread to the point where they say most kids at school have tried it. Danvers High is hardly unique. A survey from 2 years ago found across the state, more than 40% of high school students had tried vaping. 1 in 5 said they're regular users.
Today, I'm officially declaring a public health emergency in the Commonwealth.
The governor cited those statistics a month ago when he ordered a 4-month ban on vape product sales amid growing evidence that vaping is making people sick.
In order for our medical experts to collect more information about what is driving these life-threatening vaping-related illnesses.
More than the threat of illness or death, the ban may be impacting teen users.
I think the ban is an action instead of just words. Since it's so out of reach, it's kind of stopping them.
So you're seeing less vaping now?
I have, yes.
But since vape sales were banned, cigarette sales have gone up at the 30 convenience stores Leo Vercoloni owns in Massachusetts. He says as vaping became more popular over the past couple of years, cigarette sales dropped off. But in the last month, his managers have responded to an increased demand.
So where they may have ordered something in the vicinity of 20 or 30 cartons a week, now it's up to 35 cartons.
Vercoloni also owns 3 convenience stores in New Hampshire.
And our stores on the border, which is Salem and Nashua, have about tripled.
Tripled in vape sales?
Tripled in vape sales.
Vape customers, he says, tend to be adults who've switched from cigarettes. But you only have to be 18 to buy vape products in New Hampshire. And from Danvers High, the state line is just a 30-minute drive.
Kids are turning 18. Everyone knows the upperclassmen, and they'll have them get it for them. Sometimes I don't think that it's not because they don't want to stop. I think it's because they can't stop.
Still developing teen brains are particularly susceptible to addiction. And the most popular vape device, Juul, delivers in a single pod as much nicotine as a pack of cigarettes. Stephanie Leydon, WGBH News.